Welcome back to our Flu Talks podcast, where it's all about more health, less bullshit. Today we have an awesome couple that actually is in our same exact building. These are our neighbors. They're two doctors from Vital Spine and Health Studio. These guys are awesome chiropractors. They have an incredible service where you walk in. If you walk in kind of messed up, you come right back out a brand new person. Walking better, walking straighter, less pain, less inflammation, and definitely more aligned and in tune with everything that the body has to do. So first of all, thank you guys so much for always taking care of us. Fabiana and I definitely jump up there once a week. We get adjusted and we walk out of there feeling amazing. We provide them with IV services. So we've got a barter system that works out pretty damn well. So the reason why it is that we brought them in.
Megan and Justin.
Hey, Megan and Justin, you guys.
Pleasure to be here.
Hello.
Vital. If you guys are on Instagram, you can follow them at, what's your Instagram handle?
Vital Spine Studio.
Vital Spine Studio. They're here in the Kendall area. We're on 127th Avenue and 120th Street. If you guys are interested in the services that they provide, please, you can call them as well. Where can we find you guys?
786-701-8353.
Awesome.
Right. Yep. And the reason we wanted to have you guys on is because as we, not only are we firm believers in chiropractic, but
we're in the wellness space together.
But we're in the wellness space, and we've
Absolutely.
noticed that there's a lot of synergy between doing IVs and chiropractic services. Like those, to me, as clear as day, they go like hand in hand. So that's why we wanted to have you guys on, and we're going to talk about everything wellness, IVs, chiropractic, and how those two things go hand in hand for immune
Function.
Immune function.
There you go.
Love it.
Yeah, just keep me in check. Keep me in check.
Love it.
See, when you
All
got
right.
doctors here, it makes it a whole lot easier.
So how do
it's
you
a wealth
think?
of knowledge.
How do you
Have some
think
fun.
IVs and chiropractic go together? Like, what is your experience with that?
So chiropractic actually helps with immune function in itself. How does it do this? Well, by keeping your spine in alignment, it allows the nervous system to function properly. And with that being said, the brain and the body are now communicating effectively, and this goes all the way to the nerves that go into your glands that provide immune function. So with that, as well as supplementation from the outside, so we work with the inside out, and you guys are working with the outside in. And it just goes hand in hand because you provide all the vitamins and minerals necessary for the human body to function properly.
Nice.
I think it's pretty cool how the chiropractics, and correct me if I'm wrong, when you adjust people, there are toxins that are going to be released into the body, and then we can also help the body flush those toxins out. And then even more interesting than that, the synergy between them sending us clients or patients and us sending you patients, those toxins, depending on the buildup of them, will not let you guys do your job. So sometimes we have to use the vitamins to be able to get rid of the inflammation, the toxins that are causing the pain.
And the pain, right?
And the pain, yeah. So
pain.
once we can get rid of inflammation, get rid of those toxins, then you guys can come in, adjust the patient, and now that they're adjusted and the system is functioning properly, now they're at peak performance and optimal health.
Absolutely.
So why the chiropractic route? I mean, there's so many different avenues of medicine that you guys could have taken. Why?
Yeah,
and
that's a fair question.
And such an interesting one. Let me tell you, I remember the first time that I put an IV in somebody, that was pretty scary, but tell me about the first time that you adjusted somebody. I mean, the idea of so many movies that you see and they kill people Van Damme style.
We've all seen those movies, right?
And I've had it done so many times, and I think, you know, man, do I get nervous? I get nervous, but the cool thing is, and what makes you guys so special, if you have the right chiropractor, if you make that right connection, my health and my life is in your hands. So I do feel very comfortable, and it gets to that relaxing point now.
So what was that like the first time you guys adjusted?
What was that
somebody?
like, man?
So,
And who did you adjust?
you know,
You guys went to school together?
Yeah,
we did.
That's how we met.
We met at school.
We met at school.
Which,
We met
by the
at
way,
school.
guys, they're married. So,
We met at school,
which that's another. That's another. We're
That's
gonna
another
get into that.
synergy that we've got going on.
right? But yeah, so actually, let's talk about if you don't mind, just the first adjustment ever that happened. And what
Oh,
even
cool. Yeah,
made
yeah, yeah, yeah.
Like
chiropractic
In the
first
history of
adjustment
chiropractic.
ever.
How long ago was that?
In
A very long time ago,
1889.
1800s.
89?
I think 1889.
So-
1889? Wow.
Yeah,
okay.
so you had a guy named D.D. Palmer, okay? And
Put that guy's picture up.
yeah,
Right here.
find that handsome man somewhere. He gave us the opportunity we have today. But, you know, he was working in this building, and there was a janitor who was deaf working in the building. And here's D.D. Palmer, who had been studying the spine, and he started seeing that there was a correlation. There's nerves that all the nerves that we have in our body start in the spine. There's not one nerve that you have in your body that starts elsewhere, right? So it was kind of the source of where everything starts. So he started realizing, well, maybe, you know, deafness isn't an ear problem. Maybe it's a spinal problem. And the spine, you know, the nerves that go to your ear from the spine might be where he's having his issue. Maybe not so much that he has to replace his ear, right? So he started, you know, kind of doing some research on that, and he told the janitor, like, you know, janitor's like, listen, man, I've already tried everything in my power, and you know, I've been deaf for, I think it was like 10 or 20 years or something like that, if not longer. And he told him, hey, listen, so what do you got to lose? You know, let's try it out. I have a feeling that there may be a chance where you might have too much pressure on one of your nerves that goes to your ear. And that's why your ear might not be functioning right.
The vestibulocular.
Exactly. So,
What is this?
you know, your
Facial
anatomy,
nerve
man.
number
I love
7, I
it.
think. I think.
And then?
Whatever,
So he
bro.
adjusted
We'll
him?
Google that later.
So he adjusted him?
So he started adjusting him, and it wasn't, you know, a switch, but he started saying, man, I'm starting to get little like whooshing noises or like ringing in the ear where before it was just silent.
And then
so
he heard his
there
wife's.
was a change,
Then
you
he
know.
heard his
and
wife's voice for the first time, and he was like, "Can you put it back?
Can you please make me
Please
deaf
make
again?
me deaf? Have you seen?"
Shut up.
How dare you adjust me and free my nervous system? I got to deal with this, right? So, so that's actually how chiropractic started. Okay, he was able to restore his hearing, and that's the story
pretty
of
cool.
Harvey Lillard, who was a janitor and the first chiropractic patient. Okay,
Wow.
Which, actually, to add to that, Justin actually got a scholarship, and it was called the Harvey Lillard Scholarship when we first went to
I
chiropractic.
did. They
Damn.
paid for my first.
He's got looks and brain. I can see why you jumped on that.
They paid for my first year of
See why you
chiropractic
jumped on
school.
that. That's what
Yeah.
I'm talking about, bro.
Nice.
Yeah, thank you,
Yeah.
man.
Here you
Thank
go.
you. So that was pretty cool. The fact that it was named after Harvey Lillard, I thought was a pretty cool
So are you
component
saying
too.
that you don't have any type of medical school loans, bro? Because you're my hero now, man.
I'm not gonna say I don't have
He doesn't have
any,
any, he has some.
especially
That
being
is-
We
married
gave
to.
the phone number to
Yeah.
call. You guys gotta help.
So,
Pay these student loans down.
so going back to us, you know, we had we were very fortunate where we actually met in school and we hit it off pretty quickly, and we kind of were able to have each other and go through school together. But when we did get to that point where it was time to actually, hey, you know, you've learned what you need to learn. It's time to put it into action. Everyone goes, what?
Yeah. Your technique classes.
Are you
started-
So
saying-
out of
you know.
nowhere, the wax on, wax off, and everything. Now you're gonna put it together, and you're actually gonna fight. Ready? Here you go, cracker.
Yeah, exactly. So now it's like, hey, you know, you're going to put your head in somebody else's hands who's just learning for the first time, and you know this, and saying, hey, I'm putting my trust in you, you know, here we go.
So there's no dummies that
Yeah, well,
like
there's we start with bowling balls, just to like get
The
comfortable
weight.
with the weight, and then like the type of force and velocity. So you go through a lot of a year and a half, almost 2
Right.
years.
Tell me a
of
little bit about the
training.
schooling, because I mean, we'll put it out there. There's so many trash talkers that are like, "Oh, chiropractors aren't real doctors," and it's like, look, listen, you had to go to school for how long?
4 years bachelor's, 4 years doctorate.
Oh,
Okay, so
wow.
that's
8 years in
8
total.
years?
And
Yeah,
wait,
yeah,
because you
so-
guys told me there's more. And then instead of pharmacology, you guys do
Toxicology. So we learn about all the different ways that toxins can affect the body, given different medications and how that comes into play. So we really need to learn about certain medications that people are on, especially when they walk into our office, right? We need to know if they're on blood pressure medication, blood thinners, any kind of neurological medication, right? Because we're dealing with the nervous system, and it goes hand in hand. So we learn about the toxic effects of these medications and what it can do to somebody and how they can look, like their skin, their tone, their muscles, and we do a whole neural exam, especially if they're taking any of these meds, So that class specifically teaches you about all those effects of the medications and what it could lead to.
Plus countless hours of philosophy to kind of
Yes.
learn how the body works and you know how we can kind of bring
So it's
the
more
best out of somebody.
So would you say it's more like a functional medicine
Correct.
thing as well?
Absolutely. There's definitely a lot of functional medicine involved. So pretty much we start with about 1.5 years of schooling, and that includes all your anatomies, physiologies,
All the
spinal
ologies.
anatomies,
Medical terminologies.
medical terminologies, and that's kind of how they get you going. And then, you know, and then you really start to learn more of the physics involved as far
Dive
as
deep into,
adjusting
like, spinal
what
biomechanics.
vectors, you know, if you're in which part of what level of the spine, which way you got to adjust. If people have a scoliosis, is it, you know, is it a simple scoliosis? Is it rotatory? Which, you know, I may be going off a little tangent, but it really
it's okay.
does
Let
kind
them know you're
of,
smart, Papa.
it really does, you know, start teaching you about and giving you the more confidence to say, okay, I have this body on the table.
Right.
I know what I'm supposed to do. You know, and that's where the X-rays come in too. The X-rays is like the blueprint.
I didn't want to bring up with that. Yeah,
you guys do, and that's one of the things that I like so much because I haven't done X-rays on my spine in
Long time.
maybe 10 years, and that was one of the first things that you did when
Yeah.
I went to your office as a patient.
Absolutely.
And I thought that was pretty cool because you have so many.
Here we go.
this is something really important we're talking about, so the government wants to make sure that everybody's
Yeah,
tuning in.
yep.
And that was pretty cool how that was one of the things that made me like what you guys do so much is the
Right.
fact that you have so many different services in one office. I don't have to go to 3 different doctors. I don't have to go get an x-ray somewhere else. And no, you do all of these things all in
In-house.
one place.
Absolutely.
So talk a little bit about that because I feel like all of those things go hand in hand.
Absolutely.
For sure.
So X-rays are to see is to know.
The
That's,
baseline.
That's basically what they are for us. You know, we want to see what's going on so that we can treat you specifically, scientifically, and properly. So, for instance, if somebody has a specific curvature, we want to work on bringing that curvature back to the normal state, right? Normal alignment. And there's a technique that we use. It's called chiropractic biophysics. And that specific technique that both Justin and I did decide to learn, that one specifically works with misalignments in the spine, rotatory scoliosis,
Very postural based.
postural based.
That's what I have, right?
And we did start working on with
Yeah.
it. So
Well, the reason why we saw it so important to start addressing
Yeah.
posture is because we're starting to realize, yeah, you know, some people have neck pain, some people have low back pain, but what's affecting everybody right now more than anything in today's
Right here.
society?
absolutely
Posture,
text.
you know?
Right
Text
here,
neck,
that
like you
text
said.
neck. We're talking about this.
And
Yeah.
when you take the film, the X-ray, it's a confirmation, and you show somebody that, it's immediate. They're like, yeah, this is normal. This is me. We're far from it, and we need to work.
Do you think
So
text
that's-
neck is gonna be a real big thing in our very soon or near
Near future.
future?
well,
So we have a
talk
term
about
called
it.
FHP, not Florida Highway Patrol.
Okay.
Right? It's called forward head posture. Okay.
Oh, this thing?
Yep.
Yeah.
Doing
So
this?
so what's happening is that
bad.
our brains are very smart and they're very efficient and they're gonna do whatever it can at the
Makes me
most
wanna
efficient way
sit up
possible.
tall.
So what happens is if the brain recognizes that we're like this, okay, and these are students, these are people who have desk jobs or people who just have to sit, you know, for the majority of the day. What's happening is the brain is saying, okay, I see you have to be in this position for many hours. Let me
strengthen
start
the
tightening the
muscles
pecs.
to-
Let me roll the shoulders more forward.
And
Okay. Let me so that I can bring
tightness.
the head more forward, and now you can be in your working
Balance
position
it, so it balances
better.
out the body balances
Right.
out the head.
Yeah.
Have you
so
seen
it's
that
almost
big
like
picture meme where it's like the evolution?
Oh yeah, and it's
yeah.
this guy. Yeah,
Put that here. And
put that right there.
yeah, kind of like middle of the table,
but
so we
it
can.
shows like how we're gonna be and like how we're gonna end up looking over time, and it's
Now
it's
the crazy
pretty
part
bad.
is
It's
now
pretty
this
bad.
is the really crazy part, the evolution of how fast it has happened.
Yes.
Because the human body doesn't make changes that fast physiologically. It's just because you've done it on repetitions so much
Absolutely.
that the human body sees that this is a new norm. And instead of creating pain because of an unnatural position, now let's make it natural for
Right.
you.
Exactly.
Well,
Let me-
going to children really quick. We're seeing this in kids.
So that's what I was gonna say. So
We're seeing it
now,
in kids.
so now,
then
if
that's right.
the physiology,
You guys adjust kids,
Yeah.
infants, right?
Infants. I just
Pregnant
saw
women?
a 5-week-old right now before
so
coming here.
if the
And
physiology,
pregnant women
women.
too, right?
so it's real interesting. So if the physiology of the human, let's say of a mom,
Yeah.
is starting to change, does that mean that that information is going to be passed on to the new fetus, which is probably going to come out of the womb already with some type of curvature to be able to be ready for this
Maybe
new?
in the future.
This
I would
is
say so.
crazy.
I
Like,
would say so.
This is what
Genetics change.
genetically you will start to
change.
be.
There's
Yeah.
there's
This
becoming
guy.
a change in the DNA.
Yeah.
And it's starting to change lineages for sure. And that's something, that we got to be aware of and realize that, hey, it's not only
Epigenetics.
us that's getting affected, but our future, right? So these are important changes that need to be made. We're
Well,
starting
let-
to see arthritis in kids as young as 9 years old in their necks.
gosh.
Well,
People
let me
are
tell
like,
you, we had our firstborn, Davin. I had him adjusted at like 7 days old.
Nice.
So like we
Amazing.
left the hospital. A couple days after being home, I took him and he got adjusted, and he's been getting adjusted somewhat regularly ever since.
I love that.
But the biggest difference that I saw was while I was pregnant. Because I have always had really bad like sciatica pain.
Mm-hmm.
Like I actually have it right now. After we're done here, I need to go to your office.
I know a guy. Please. I know somebody.
But yeah, I would walk in, and I didn't know you guys then. I had a different chiropractor, but still, I would walk in with sciatica pain and my big old belly, and then I would walk out with no pain, which was like immediately after I would walk out with no pain. It was the craziest thing. I mean, it was
Right.
the best feeling, obviously, because
Love
sciatica
it.
pain is just no matter what position you're in, it doesn't go away.
Yeah.
But why does it do that? Why is it?
So,
What does it do, that adjustment do to a pregnant woman? Like, how does that work?
That's a great
so
question.
I decided to go that route, right? So I did a bunch of certifications in prenatal and pediatrics. So we do see a lot of those cases in our office. So, and we absolutely love it. Yeah. But as far as a pregnant woman, so what ends up happening? Your body's changing and moving. It's growing a human, right? So we have different hormones that are running through your body. One of being elastin, which is really fun because you feel like Gumby, right? So
That's when you get clumsy.
yeah, everything starts to stretch and expand. Well, some of those ligaments that actually want to do that may be taut and tender and fibrous, and they're not doing them on their own, especially now. Because back in the day, I actually overheard you speaking that, we used to hunt and gather. So we were moving a lot more. Now we're very sedentary, and this is affecting even pregnant women. So what we do is we actually work on those ligaments and give you space, give baby space so that we can continue to move, grow, and expand, and do it so that it's very light, it's very manual, right? We're doing a lot of manual mobilizations, and it allows you to just relax into the proper positioning so that the baby can move and be comfortable. So we're not moving baby, we
So
are
it's more
moving,
of the pelvis,
yes,
right? Which is what's holding
the pelvic
up,
floor.
right? Which is what's holding up the weight of the baby,
Right.
right?
So by loosening up these ligaments, we're allowing those muscles to work better and efficient.
And then now I would expect the pelvis, instead of being like this, now you adjust
As
it back
well.
into place, and then now you don't get those
Right.
sharp
Correct.
pains, right?
Correct.
Right.
Something
So
like that.
remember,
we do a lot more
That's
soft
my
tissue, too.
interpretation.
Yeah, no, that's
Yes.
right on.
There's
And
remember,
I've heard that that's also. I knew actually a girl that her baby was what's it called when they're
Breached?
The
Breached.
baby was breached. She was like 3 weeks from like giving birth, and the baby was fully like facing up instead of down. And she started going to the chiropractor every however long they told her to go. I think every week or a couple of times, 3 times a week, and the baby started turning.
It's amazing.
Because I guess whatever was, and tell
stuck.
me,
Whatever was stuck.
Whatever was stuck
we
or whatever
put
was-
joints into motion as well as addressing the soft tissue, right? So by putting those joints into motion, we allow the body to do its own healing, its own movement. And a baby feels that and innately will be like, okay, now I have some room.
Now, you said something I know
That's so cool.
before we were talking about this, and I
Yeah.
had asked you, I go, do you consider yourself a healer?
Right.
And what was your answer, which was so cool?
Your body does the healing.
Yeah,
Your
we're not
body does the
healers.
healing.
We're not healers. We are
We're not.
facilitators.
Yep.
Okay, so what we do is we believe that the body is made perfect.
Yep.
Okay, and through.
If you want to see that, I'll stand up.
Oh,
I already know by look.
Please.
All we got to do is look at
Oh,
Danny here, and we know that the
Jesus.
body's made perfect.
Please don't fluff him up anymore, okay?
I mean, come
His
on.
ego does not need any fluffing.
I'll send you your check
Trust
later.
me.
I'll
Thanks,
send you your
man.
check later.
Need
I'll send
that.
you your check later.
I'll be waiting for it. But yeah, you know, it's not that we're these miracle workers or magicians or you know, I get patients tell me, Doc, I haven't had a headache since I've started coming to you. It's been 3 months. It's amazing, you know, and it's
That's a good
like
one.
that is amazing. You know, it's amazing to me too. It's not like I just was treating you for your headaches. No, I'm treating you for wherever there's some sort of interference in your nervous system, and we're just freeing that up. Now, if your body's showing it, and oh wow, then no more headaches. You know?
What else do you guys have for patients that are suffering from like chronic pain of some sort?
Absolutely.
Whether it's
You guys.
shoulder.
Well, actually,
We got you guys, right?
I think
We've got you guys.
so. Instead of that question, I think a more fair question, so you guys can definitely showcase what it is. What kind of symptoms would a person be showing that you guys would be able to address? Like, if somebody is watching this and they're like, hey, I've got this or I've got that, I wonder if they can take care of that.
That's a great
like,
question.
Give me the spectrum of well, if
symptoms.
you got this, we
Anything
can
of
probably
symptoms.
take that. We can get this, we can
Anything
take
and
that.
everything.
Yeah.
Why? Because
Like
we
what?
work with the nervous system.
Okay, so,
So
can
say-
you, headaches.
Yep.
You can get rid of those.
Constipation.
Like what, migraines?
Wow,
We'll do one better.
constipation.
We'll do
Yes.
one better. Name it, and I'll tell you if we can help
Yeah,
it. And
that's
I
what we're
guarantee
doing.
you the answer is going to be
On
yes.
today's show,
Now, and I say this with all the confidence in
Constipation
the
too?
world.
erectile
that's
dysfunction
why-
for 500, Alex.
What about
We can help.
We get up. Well, the constipation is a good one. I see babies all the time that are either constipated or have colic, and I adjust them, and I also do maneuvers that we learn to help them release gases. And I mean, today, mom was there, and she's like, "No, he doesn't burp, he doesn't poop, he just holds it in. I feel him straining. I did one little adjustment. I went like this, and the baby went." And everybody was praising
must have
him.
been so
Didn't make it out of the office.
No, he didn't make it out of office. And mom was like,
And then
wow,
he
the
fell
only
asleep
place you'll
like
get praised for farting. Yeah.
So here's the thing, you know, I
So-
think in today's society and our generation now, it's very symptom based, right? And that's why I kind of answered that the way I did, because, you know, and I mean this as sincerely as possible. You know, you may come in one day and have a headache. The next day that you come into my office, it may be lower back pain. It may be sciatic pain. What I'm doing isn't going to change much, you know, from the first day to the second day. All my job is to do is to check the spine, see where the interferences are in the nervous system, and release that so that your body can function at the best possible, efficient way, you know, that you can. So through that stuff, your symptoms will subside.
Right.
You know? So I get people all the time, and after a couple adjustments, hey, Mr. and Mrs. Jones, how you feeling after your first couple adjustments? Well, doc, you know what? My neck pain's a little better, but you know what? I could have ice cream at night now. And I'm like, wow, I didn't even know you had that problem. You know? But here we are talking about it, and she's like, yeah, that's one thing I've realized. Or hey, doc, you know what? I'm able to digest pizza, or I'm going to the bathroom better.
But aside from
and it's like,
Sleeping better.
aside from adjustment, what else do you use to like manage pain?
Oh, we
Sure.
have several modalities. So
yeah,
we
so
also use
we offer cupping, right?
correct?
I do the
Electrical
cupping
mo-
with you guys, which
Yeah,
is freaking
yeah.
awesome.
It
That
is.
has
It's
I
helped
love
him a
it.
lot for
Awesome
his
soft
shoulder pain.
tissue-based therapy.
He
I
couldn't
highly recommend it.
lift his
Shoulder.
his arm because of a shoulder pain, and ever
Yeah.
since he did the cupping, like he can actually
Right.
It's
It
amazing.
increases
He can
blood
raise his hand
flow
now.
by bringing oxygen to the area. We spoke about oxygen earlier.
Removes toxins, gets
Removes
lactic
toxin-
acid out of the
Exactly.
system.
All that good stuff.
And
Now
then
you've
boom,
got
you
new
now you put
free-flowing
an IV
blood.
in you, and you're a superhuman.
Exactly.
Yep.
But hey, they could always take pills, you know?
Let me ask you a question. Why is
That's the
it?
shortcut.
Why is it?
Band-Aid.
Why is it that primary care physicians or orthopedic surgeons will tell their patients not to go see a chiropractor?
Love that question.
Yeah, clearly it's because they're not knowledgeable of what it is that we actually do. Most of them will be like, I've had patients ask their primary, but why not? And they're like, well, I don't know. I've never been to a chiropractor. So
They
they'll
don't-
tell them straight up.
They don't believe in it. We've
They're
got patients
like-
as well that do not
Yeah.
believe in the power of vitamins, and if with the proper knowledge and the use of
Right.
vitamins at the right dosage to beneficial levels,
Right.
I mean,
Well, it's like gravity.
you
I
can
mean,
get
you
rid
can-
of all of the worst C's to have ever been on this planet. COVID,
Yeah.
cancer, all kinds of stuff. I mean, the things that you can't talk about, but there's vitamins and minerals that are strong enough to be able to combat this.
Absolutely.
And the Western medical system really frowns upon it because it is what it is. You're messing with their money. I mean,
Right.
You-
But
There's
it's
always-
like, it's like gravity, because you're like, oh, they don't really believe in it. I'm like, well, it's like gravity. It's going to work whether you believe in it or not. I've had plenty of people walk into to my door like, I've tried everything. You're my last resort. I don't think anything's going to happen. And they're walking out like in tears saying, I can't believe I went under the knife. I've taken all these meds and it took one adjustment and it created change.
Yeah.
That's amazing. And
Absolutely.
to us, we have conversations every single day after a long day in the office, and we talk about not the pain aspect. Like, we could care less whether we got rid of pain. We care about somebody coming in saying, I was able to sleep for the first time in weeks, sleep through the night. I am breathing better.
My baby's latching.
My baby's latching on my breast now. Like, things like this is our wow moments.
Right.
And,
It's about improving somebody's quality of life.
Right.
It's so much more than. Of course, I care about your neck pain getting better, and of course, I want your lower back too. But more importantly than that, you tell me you're going to the bathroom better, dude. Forget your. I don't. What?
That's relief.
Yeah.
Right
Who cares
there.
if you have
That's
lower back
relief.
pain, man?
those are normal body
I mean, now all of a
functions
sudden
that
you're going
should
to
be
the
happening
bathroom
no matter
better.
what. And I mean, pain is just a little signal that your body's sending, saying, hey, something here is wrong. And, a lot of people are like, oh, I have this little dolorcito por aquí. Let's take some Advil.
Right.
You're covering up a very, very big signal that your body's trying to send you. And in reality, most of the time, it's movement. Motion is lotion. If you don't move it, you're going to lose it. So
Now,
Look at this.
what would you say? Hold on. What would you say to the people that say that, oh no, because I've been to a chiropractor before and I left there worse, or it hurt to get adjusted?
It's a good one.
Yeah,
That's a
Should
good
absolutely.
one.
chiropractic adjustments hurt?
Great question.
Sometimes, yes, they do.
So,
but-
first of all, pain is very subjective,
Yes,
right? So what
exactly.
might hurt you might not hurt me. What might hurt him might not hurt her, or vice versa, right? So pain is very subjective. Doesn't mean we don't ask about it. Of course, we ask about it to show that we are considerate with people's pain and we care. But, I may adjust you for the first time. If you've never been adjusted before, I mean, what happens when you go to the gym for the first time, right? You
get
come out a little
very
sore.
sore.
Now, does that mean that the gym's bad for you?
No, but
You
I'm not
just
talking
brought
about
up
soreness. I'm
memories.
talking about-
I didn't do biceps for
Hold
like
on.
6 months once, and I couldn't move. I swear to God, for 3 days, I was like this.
So you had to
Be-
stop going to the gym, you know?
And then to stretch, it was kill yourself.
Right.
No, but I'm not talking about soreness. I'm talking about like pain that they're like, oh my God, I went in because I had X pain and I left there even worse, where like I couldn't even turn, or like
Again.
I had like I was stuck.
Right.
That like
Again,
worse
like
pain.
you said, it's subjective, right?
Right.
So another thing we're doing when we adjust the spine, we're also waking up nerves, right? So something that could have been shut off and you're not feeling, it's already getting to the numb state. Because we ask you, is there any numbness? Are there any tingling? Well, if you've already been dealing with this pain for years, right? Because we have people that come in and say, oh yeah, 3+ years.
Right.
Don't you think that those nerves are going to start to say, all right, we're not doing anything about this. We're not.
So I'm
they're not
gonna
using
turn
it.
off.
We're turning off. Now we're starting to wake those nerves back up. They're going to be in pain. Especially somebody who's sedentary, who sits all day, who doesn't exercise, doesn't drink water, because I've gotten that. Oh, what's your, when was the last time you had water? Oh, I don't know. I drink Mountain Dew. And I'm just like, there's your first problem, So it's a lot of things. It's
A lot of factors.
combination of everything.
And it's hard
They're
to
super
pinpoint to one thing for
inflammated,
sure.
right? So, and I'm not saying there can't be a bad adjustment. Just like there's a bad adjustment, there's plenty of doctors who have killed people in surgery. And it happens.
Yeah.
And this is why you
But it's not
have
the
to-
norm,
It
is what
isn't
you're
the
saying.
norm.
It's
It
not the
isn't
norm. And again, is pain a good thing or a bad thing, right? So
you're alive.
It lets
So-
you know
so
you're
most
alive.
people-
Well, it lets you know that there's something going on there.
right, exactly. So pain is just a signal. It's not the actual problem, right? But most people have lost, sight of that, and what brings them in is pain. So thank God for pain, right? Because that's how we eat. But and I want to get people's mindsets away from that. It's not so much about, anybody here ever know anybody who's had breast cancer?
No, unfortunately.
Yes.
Not a close person.
Okay. Well, unfortunately we have had plenty.
Plenty.
And I can tell you 100% of these women never had pain.
Right. Yeah.
So what is pain, right? Yeah. So just because an absence of pain doesn't equal health,
Right.
Correct.
okay? And health doesn't equal an absence of pain. All right. So we got to get away from that and stop thinking that we got to wait for pain to go do something about it. We don't wait for a toothache to go to the dentist. Right. We just go. Preventative, right? So we go, whether they tell us, hey, every 6 months, every 4 months, whatever, what have you. We don't wait for that toothache to say, go to the dentist. So why are we waiting for our next to her? Why it's already late. Okay, your body is amazing and it does all these compensations to help you get through your day. So you might have a problem there for years before you start feeling pain. But the pain is your body saying, hey, listen, I've already done all the compensations possible. There's nothing else for me to do. Send the signal of pain. Okay, now I'm getting neck pain. Okay, well, it's not so bad, especially us guys. We like to say, it's not so bad. We can still work. We can do our thing. And then all of a sudden, what brings them into our office is, hey,
I can't move my left arm.
Yeah. I can't bring my arm up.
Yeah, it's when it starts really affecting their daily activities, and why wait for that? Why not just start now? Let's get your spine checked. I'll be the first one to tell you, hey, everything's perfect. Come back in a month, I've never done that in my career. I would love to do that. I've never done that. Why? Because I've always found something that was already there. Okay, but
that maybe
right
it's
now,
not an issue at the moment, but if they leave it the way it is, long term, it's going to turn into something.
But I'm still seeing way too big of a pattern, and the ratio's still way offset too much in the sense of 95% of our patients are already coming in with pain.
Oh, yeah.
I want to change that. I want 90% of my patients to say, hey, listen, I have nothing going on, but I really want to get my spine checked and start nipping this at the bud now. I would love that.
What do you think what would you say is the thing that separates you guys from other chiropractors? What makes you guys
unique,
special, or unique, or
it's kind of hard to answer that in the sense because we have so many good chiropractors in our
industry,
man.
And we're such a small community, and not enough people see chiropractors. So it's
that's another beauty.
We're actually working with each other and not against each other. I refer.
I've said
other
this
chiropractors
so many times. Only in the wellness space is there no competition.
There isn't.
Because I have a doctor that I refer to all the time.
Your intentions are to have that person feel better.
Absolutely.
Now, whether I'm the one that physically took care of you and monetarily was able to provide more of a lifestyle for my family because I took care of you, I don't really care about that. What I want to do is make sure that my patient feels better.
Absolutely.
And that it has value on its own. And only in the wellness space do you see a lot of people. I mean, we had one of our competitors call us yesterday. They're like, hey, listen, can you get your hands on some vitamins? Because I don't know where to get these right now. And I was like, hey, listen, call this guy. He'll take care of you.
Exactly.
I could have easily been like, hey, send me your patient and I'll take care of him. But it's
not about that.
Right.
It's, hey, let me show you how it is that you can be able to do this. Here's a better route. Here's a hand so that you can continue providing a service to people, actually make them feel better.
Absolutely.
But on that note, though, what makes us
you
unique?
Guys feel unique?
Right. We treat you like family. Exactly like that. And I feel like that is part of it. By being able to connect with other chiropractors in our neighborhood and, in South Florida, period. We just want to treat you like family. I'm going to treat you like I treat my abuela, like I treat my brother. That's what we do with everybody who walks into our office, and we do the same with our fellow colleagues.
That's awesome.
And another thing that I wanted to bring up about pain. Let's go back to that really quick. That's why we say, bring me your child. He's perfect right now. Let's keep him that way or her that way. And this way, throughout their life, they're living at their optimal function, right? And that's why kids should see a chiropractor too.
Yeah, I'm a firm believer that if we can get, our hands on these kids and as early as possible, we're gonna be able to avoid so many, issues that may happen in the future. My dream is to have a chiropractor at every delivery room in a hospital.
That'd be amazing.
That's my dream.
I'd be right in there.
And
because when they pull the kid out, you're yanking at their head and their spine.
Birth trauma.
No. Let's not. Listen. How about sleeping in a ball for 9 months?
Exactly, or you're like this all time. Yeah.
The baby would ask for the service if he could.
Absolutely.
I remember.
Umbilical cord or chiropractor?
When our son Davin was adjusted at
the answer.
When our son Davin was adjusted at 7 days old, I remember he just did he was they're tiny and they're and then he just did one of these.
Yeah.
Yeah.
And he just like relaxed, and I was like, "Whoa, what just happened?"
Changing the nervous
and
system.
he was
Amazing.
like so
Amazing.
calm after that. He just looked at everything. He did not cry. He just looked, and it wasn't like in you guys, you know,
Right.
like it's not like a big adjustment. It's just
No,
like a
of
little,
course. Right.
you
Yeah,
know,
I'm
a
not going to
little
adjust
tiny
a...
thing at like the
Yeah, we're not
spine.
adjusting a newborn the way I'm adjusting Danny. You know, it's just...
it's the firmness of what you would check an avocado.
An avocado.
That's how you adjust
Yes,
a baby.
that's as much pressure as we
All right,
put.
so
and check
I
it.
have one last question, a,
do it.
a
Go for it,
juicy
let's
question, since you
All
guys
right.
are married and
Bring
we're
on,
married.
bring on the juice.
Bring on the juice. All right. So how is working with your spouse?
I love it. I love
How do
that
you guys
question.
handle
How do we keep saying
disagreements? And how do you not choke each other at times?
Well, you know, we do get into fist fights.
Real fast, let me tell you.
And then we have to
We
adjust
do
each
kick
other
each
after.
other.
I have the bottle of tequila right under this table.
Yeah, exactly.
Okay.
That keeps us
Right.
adjusted.
Everybody has their thing, right?
In line.
That's too funny. Well, we actually know our strengths and weaknesses. Strengths and weaknesses.
We're gonna keep that in there. Do
it
not take that out.
Don't cut.
But the beauty of us going to school together taught us how to work together. So we did it for 4 years at school. Those were the hardest years of, well, we can say the hardest years of our lives,
Absolutely.
even up to now.
Yeah, I can say that.
You know, boards,
With all the confidence.
exams, all of that. So we helped each other through that, and we were able to work with each other, and we learned our strengths and weaknesses then, and we were able to apply it now in business.
Yeah.
So, and then
Honestly.
we make sure that our downtime outside of the office, we do things that we love. He plays golf. I go to Pilates, yoga, and hair, nails.
Hair nails, eyelashes.
Hair, nails, lashes.
Wait, we won't compare budgets here.
Shopping and all that.
We're not talking about budgets. We're not talking about budgets.
We won't compare budgets.
Maybe that
Let's not
purse
talk
I
about
put on the
budgets.
credit card last week. But yes, so we keep each other sane
You
in
go
that.
through that too.
Oh, you thought it was only you? No, dear.
We'll cry about it
Happy
later.
wife, happy
Be
life.
successful, they say.
We'll bring up
It'll
the
be
tequila bottle
fun.
later.
Tip for men.
Yes.
Happy wife, happy life.
That's it,
Go
man.
play golf.
Yeah, go play
Go
golf.
play golf. Exactly.
Can you take me with you?
You don't know how to hit a ball.
So,
He's not only going to get frustrated with you
Yeah, I'll teach
when you
him.
can't hit the damn ball.
We'll make it happen.
so here's my closing comments on all of this. And I think it's a pretty cool one. So somebody that has never been to a chiropractor, they walk into your office. What is this experience going to be like? What do they look forward to so that we can inspire somebody to not just walk in through your doors, but through any chiropractor's door? Because I would expect the same intention is going to be there, which is to bring some type of wellness and health into your life. So I've never been here. I knock on your door. How does this go down? What do you guys run me by?
First
an
visit.
initial
What's that
visit?
experience?
Absolutely. So you're gonna come in. You know, you'll check in. You'll see Alex's awesome warm face there to kind
She's
of
the best, man.
right, isn't she? Just to help you fill out paperwork and answer any questions you may have. But really, what's gonna happen? We're gonna bring you in. We're gonna have a conversation. Okay. People like to call it a consultation. For me, it's just a conversation. All right. We're gonna talk about things you're feeling. We're gonna talk about things you're noticing that have changed in your body. What do you like about your body right now? What do you not like about your body right now? And we're gonna, you know, have that conversation as to what we can do to start helping you achieve your goals, right? So we go over goals. If we got to take some images, we're gonna take some images so it can help not only my job be a lot easier and give me that map and blueprint of what to do, but also I can kind of educate you a little bit more as to what I see is going on internally. So once we go over all of that, then we start treatment. You know, we go over a recommended treatment plan. If it works for you and it works for us, you know, we hit the ground running. You know, there's no reason to hold back at that point. But really, I would say 90% of it is education.
Yep.
You know, it's to me, the only way you can grasp, because if not, some people, you know, they go on TikTok, they look at a video and they say, yeah, I want to go get cracked, you know?
This is why
But
we
there's
do
no-
these podcasts,
Yeah.
education, so
Yeah.
people have more clear understanding of what it is they're getting themselves into. So,
Right.
in other words, what you just told me is pain isn't what has to bring you in through your door. Any
and it
type
shouldn't
of
be.
discomfort or something that is holding you back from living an optimal, comfortable life, you guys may or may not have a solution, but you at least want to know what the problem is so you can offer something.
Absolutely.
And if you don't have something, you're happy to tell them, I can't help you.
We could refer
But my
you,
friend's Flueless right there downstairs.
Can still
But
help
that's
you.
the cool part about like this collaboration because
Exactly.
we send patients to you guys. You send
Right.
patients for chiropractic. You send
Yes.
patients to us for IVs. So it's like now they're getting double the benefits of just
I think that combination is like
one of us by
it's
ourselves.
perfect. It's
flawless.
like the perfect formula to make you, like she said, superhuman.
Yeah.
You know, I mean,
not
I know
just
I've
that,
felt great since I started getting my IVs with you guys.
Absolutely.
Just like I started feeling great when I first got my first adjustment and literally changed my entire life. I said,
Yeah.
wait, what am I doing going to medical school? This is where it's
I
at.
look forward to getting adjusted
You know?
every week.
Yeah, man. I mean,
It's
who,
also nice when you can refer to you guys who we already have a relationship with, and people are more comfortable. They're like, I'm like, oh yeah, they're amazing, and we speak wonders about you guys, and it's a true relationship.
Yeah.
And they feel that, so it's nice, and people love that.
I'm all about authenticity.
Absolutely.
same.
They say the number one feeling that the strongest emotion that you can feel in life is authenticity. It's even stronger than love. It's pretty crazy. Like you feel
is.
somebody's
Yeah.
the realism
The
of
real.
somebody.
They're-
Like you,
they're genuine
I either
and-
know that you're full of shit or you're not.
Correct.
Exactly.
And with the right adjustment, you can get rid of some of this shit. Right?
You're,
Absolutely.
you're one adjustment away
Absolutely.
from a good mood.
Yeah, we have that on
That's
the
about
wall.
mood or a good
That's
poop.
cool, man.
I like that. I might add
You
that.
should put that on the wall.
I might add
You're
that to the
one
wall.
adjustment away from a good poop.
That's a good one.
People are gonna be like, yes,
Thank
I'm
you
in.
guys so much for coming
it was
in
awesome
and doing
to
this
be here.
podcast
Always
with us.
It was
And I
awesome
hope
to be here.
if you guys have any questions for the people watching, if you have any questions regarding IVs, reach out to us or comment below. If you have any questions regarding chiropractic services, feel free to reach out to our friends at Vital Spine and Health Studio. And thank you again for spending this time
Thank you
with
for
us.
having us,
Oh,
man.
yeah.
We had a blast. We got to do it
Thank
again.
you.
Let's
Awesome,
do it.
man.
Hopefully, we can
We'll
come
be back
back
for
on
more.
soon.
All right.
And thank you guys for tuning into another podcast, another episode of Flu
Flu
Talks.
Talks.
More health,
Less bullshit.
I like it.